This is a group that doesn't talk. They view reaching out as weakness.
You know, some of you even described yourselves as light switches to me. I just turn it on and turn it off, right? Work at work, home at home, I've heard that. And I envision, I just want to go stand at the light switch, flick it on and off, and on and off, and on and off. How long do you think that's going to take until something gives? Why are we so unwilling to accept help?
We don't think we need it.
I think even when we know we need it, we don't want it. I think it comes with that stigma. I want to be the one that's in charge all the time. I want to be the one that everybody thinks that they got their shit together. We don't have our shit together. We don't.
They suffer in silence. They're afraid of speaking out of what they're struggling with. They feel alone. We realized there was a problem, so just kind of started talking to them as a peer, and then realizing that we need a lot more of this.
We talk about the normal stress curve for an average person, a normal person, which you all are not normal. You're going to be right about here while you're working, and this is where nothing is going on. This is just you being in your patrol cars or being in the community. You're going to have a higher level of stress. Why?
Because we always got to be on or prepared mentally.
You always have to be on. It's called hypervigilance. So if you get that full adrenaline dump, you're going to go all the way up here. What's hypervigilance do for you?
Energizes.
It does. It energizes. So you get this false impression that you feel better at work than you do at home. How much time are you spending on that sofa? If you look at hypervigilance in general, if you go home and sit down and you haven't done anything to work out those chemicals that kept you so high all day long, it's going to have negative residual effects. Now, when you're driving home today and thinking that you have this free night, what are you envisioning doing? Relaxing. And you walk in the door and they say, let's go out to dinner. But you really don't want to go. So you get there. Most of you like to sit facing the door. Why? Threats, potential threats. Goes back to your training. You could probably tell me who's sitting in the corner, what they're wearing, but if I asked you what your significant other was wearing, you might not be able to tell me. They get why you face that door. They get that. They don't understand that once you're there, why it continues.
You know, I always joke around and say they come in and they realize that I'm as messed up as they are, so it makes it a little easier to talk to me.
I had to focus on the fact that I was dealing with depression at that time. And who wants to hear that?
I struggled with depression myself, and I didn't realize I had it. Somebody had to tell me I had it, which was quite embarrassing because this is what I do. I teach about this. I should know. My first thought was, you're wrong.
Who's going to trust me? How are you going to let me help you when you now know that I let myself get depressed?
The overall goal is to make this more common practice that we are going to take care of you. We are going to reach out. We're going to make sure you're okay. And you shouldn't be embarrassed to pick up that phone and say, I had a bad day. The courage for anybody that's struggling with a mental health disorder to be able to speak in front of people and just speak of that vulnerability that you kept such a secret because maybe you were embarrassed by it, maybe you were ashamed by it, maybe you felt you were weak because of these things occurring. I applaud them all to be able to sit in this chair. I always joke around and say my one hope would be, if I could ever do this, would be to get every person in the room that our team has worked with. So everybody can look at everybody else and say, wow, I would have never thought you. When you see that it doesn't matter how trained you are, or how tough you are, or how seasoned you are, this can affect anybody.